As a sports medicine doctor, one of the main complaints that I'll often see is knee pain. And very often, knee pain can come in the form or the presenting sign of a meniscus injury. So the meniscus are these cartilaginous pieces of tissue that sit between the two bones, the femur and the tibia. We have two meniscus, an outside one called your lateral meniscus and an inside one called your medial meniscus. The roles of the meniscus are really to help kind of take some of the shock absorption and some of the weight-bearing load from all of our day-to-day activity, whether it's exercise, whether it's walking, or any kind of just regular daily activities. Over time, that meniscus can cause some fraying or can be torn a little bit and can often cause a lot of symptoms. Symptoms of a meniscus tear can include pain, swelling within the knee, difficulty walking, popping or clicking sensation within the knee. Now, with most musculoskeletal injuries, there's two types. There's an acute meniscus injury or an acute injury where somebody may be working out or playing sports such as basketball. They twist and they feel a sudden onset of pain. And that is treated differently compared to the second type, which is a chronic injury, where pain may occur over a period of time and may gradually worsen. In either case, it's appropriate to see a physician who sees meniscus injuries and knee pain on a regular basis. As part of the workup, I will often do a very thorough history and physical examination, specifically trying to look for meniscus injuries or other concomitant injuries or issues. If further diagnostic testing is needed, we'll often get an X-ray to look for bony pathology, which is really helpful for looking at both the bones and the joints to see if there's anything such as osteoarthritis associated with this. But the best way to look at the meniscus is by doing an MRI evaluation, to look at the soft tissue and evaluate. It's kind of the gold standard in terms of diagnosing these kind of injuries. Once the diagnosis is made, we'll often talk about treatment plans. And treatment plans for musculoskeletal care in general, we always try to do the conservative things first, things such as physical therapy, medications, whether that's non-steroidal anti-inflammatory medicines or topical medications to treat your pain. All of these are kind of the best ways to really help reduce some of the symptoms and strengthen some of the surrounding tissues in order to offload the joint. When pain has gotten to the point where you cannot tolerate some of those conservative measures, or you've tried them and still have symptoms, we'll often talk about various injection therapy, such as a corticosteroid injection to help reduce some of the pain locally, which is a preferable way a lot of times to reduce some of the systemic absorption of medications. In terms of surgery, there's a lot of controversy or thought process in terms of meniscus surgery treatments. The issue with the meniscus, it doesn't have a great blood supply. And so not all meniscus tears will respond well to surgery. If you have some degree of osteoarthritis and you develop a meniscus tear, by doing a surgery, it actually can make arthritis worse. And so many times we'll try to treat meniscus injuries and meniscus tears non-operatively with physical therapy, injections, and a dedicated strengthening program. Hopefully, with treatment as a non-surgical approach and a conservative approach, people will feel significantly better and will get back to their regular activities of daily living, their exercise, and just overall great health.